Bismillahirrahmanirrahim. Quote for the day is, but perhaps you hate a thing and it is good for you, and perhaps you love a thing and it is bad for you, and Allah knows while you know not. The topic for today's presentation is cancer. I am Dr. Ayesha Amin, PGR of FCPS Community Medicine at Institute of Public Health, and I will be presenting this under the kind supervision of Professor Dr. Saira Afzal. The learning outline for today's presentation is global patterns of cancer, risk factor, prevention, screening, breast cancer, cervical cancer, lung cancer, recent update in cancer, and multiple choice questions. Learning outcome. At the end of the presentation, the participants will be able to describe the risk factors, screening, prevention of the common type of cancers, and to be able to answer the MCQs. So, what is cancer? A cancer is a large group of diseases that can start in almost any organ or tissue of the body when an abnormal cell grows uncontrollably, go beyond their usual boundaries to invade adjoining parts of the body and spread to other organs. Problems treatment. According to the Globocoin 2022 data, in 2022, there were an estimate 20 million new cancer cases and there were 9.7 million deaths were reported. The estimated number of people who were alive within the 5 years following a cancer diagnosis was 53.5 million. About 1 in 5 people develop cancer in their lifetime. Approximately 1 in 9 men and 1 in 12 women die from the disease. So, global cancer pattern. Lung cancer is the most commonly occurring cancer worldwide, with 2.5 million new cases accounting for 12.4% of the total new cases. Female breast cancer ranked second, about 2.3 million cases, colorectal cancer, and then prostate, and followed by stomach cancers. This diagram on the left side shows the absolute number or incidence of cancer in both the sexes. The most common type of cancer in both male and female is lung cancer, followed by breast cancer in female, then colorectal cancers, prostate, and stomach cancer. While the absolute number or the mortality in both the female and male is because of lung cancer, and then followed by colorectal, liver, breast cancer, and stomach cancers. So this diagram shows the most common type of cancer incidence by Globocoin 2022, and the green part it shows that the most common type of cancer in male is prostate cancer, and the blue area in the upper diagram shows the lung cancers. While the lower diagram it shows the most common site of cancer in female, and the pink areas shows the incidence of breast cancer around whole world in the female. This diagram it shows the mortality rate again in the whole world around the globe. The most common type of cancers which leads to death in males. The upper diagram shows this. The blue color represents the lung cancer, and the most common type of cancer which leads to mortality in male is lung cancer. While the lower diagram it shows the most common type of cancer which cause mortality of females, and the pink color they shows the incidence they shows the mortality because of breast cancer, and the orange color it shows the mortality due to the cervical cancer. The incidence burden of the major cancer in Pakistan, according to the Globocan 2022, the most common type of cancer occurring in Pakistan in both male and female. The left side of the diagram shows the most common type of cancers in male, and they are lip and oral cavity cancers, and then followed by lung cancer, colorectal cancer, prostate cancers. And while female, the majority or major type of cancer which occur in Pakistan is breast cancer, followed by the lip and oral cavity cancer, then ovarian, and then cervical and uterine cancers. So, what are the major risk factors for the cancers? There are certain biomedical factors, lifestyle factor, and environmental factors which leads to cancer. The biomedical factors includes the genetic susceptibility of a person to have cancer. Then there are certain hormonal factors in female which leads to the development of cancer. The lifestyle it plays a major role in the development of cancer. The smoking habits, alcohol consumption, physical inactivity, and obesity, and chronic infections and certain diet they can lead to the cancer. While environment it plays a major role like sunlight, radiation, occupational exposure to certain agents, and pollution, it all leads to cancer. So, what can be the prevention strategies to prevent cancer? The primary prevention, which aims at health promotion, includes personal hygiene. We should take diet which is enriched in fruits and vegetables, control of tobacco and alcohol consumption, food, drugs, and cosmetics. They should be tested for carcinogen. Radiation exposure should be minimum. Special effort should be made to reduce the amount of radiation, including medical radiation received by each individual, to a minimum without reducing the benefit. Occupational exposure, the occupational aspect of the cancer are frequently neglected. So measures should be there to protect the workers from exposure to the industrial carcinogens should be enforced in industries. Air pollution, control of air pollution is another preventive measure because it leads to the lung cancers. So the second step in primary prevention is health education. There should be legislation to control the environmental carcinogen like ban on tobacco smoking, alcohol, and air pollution. And there should be cancer education. There should be education seminars and awareness walk to aware people about the risk factor of the cancer and to motivate people to seek early diagnosis and treatment. And specific protection includes immunization. For example, prevention. The cervical cancer can be prevented by the immunization against human papilloma virus. The secondary prevention, it aims to at the early detection of cases and prompt treatment. So cancer screening is the main weapon for early detection of cancer at a pre-invasive or the in situ or pre-malignant stage. And then prompt treatment, we have variety of treatment available for the cancer ranging from surgery, radiation therapy, chemotherapy, immunotherapy, hormone therapy, and stem cells therapy. So, screening of the cancer screening may be defined as the search of unrecognized malignancy by means of rapidly applied test. The US Preventive Task Force and the American Cancer Society are the two organizations that widely issue cancer guidelines. So, there are screening is recommended for certain high risk cases, and there are cancers for which screening is recommended for average risk people. The screening which is recommended for average risk people include breast cancer screening, cervical cancer screening, and prostate cancer screening. And the screening which is recommended for high risk group, it includes colorectal screening, lung cancer screening, and liver cancer screening. So the type of screening, it is divided into mass screening and high risk or selective screening. The mass screening screens whole population or community irrespective of their risk, and it is usually less cost effective. While the high risk or selective screening, it is applied relatively to the focused or high risk groups, and it is usually cost effective. What is the SEER program? The SEER is the Surveillance, Epidemiology, and Unresult Program of the National Cancer Institute. It is an authoritative source of information on cancer incidence and survival in the United States. SEER currently collects and publishes cancer incidence and survival data from population-based cancer registries covering approximately 48% of the US population. The SEER program registers routinely collect data on patient demographics, primary tumor site, tumor morphology, and stage at diagnosis, first course of treatment, and follow-up for vital status. The SEER program is the only comprehensive source of population-based information in the United States that includes stage of cancer at the time of diagnosis and patient survival data. So the cancer registries, there are population-based and hospital-based registries. The population-based registries, they record data in a defined population, most frequently a geographical area or a state or metropolitan area, with an emphasis on the use of data for epidemiology, the science used to find the causes of health outcome and disease in population. So population-based registries, they are designed to determine cancer patterns among various population or subpopulation, monitor cancer trend over time, guide planning and evaluation of cancer control efforts, help prioritize health resource allocation, advance clinical, epidemiological, and health services research. Cancer surveillance programs such as SEER program use cancer statistics collected by population-based registries to monitor the distribution of cancer cases by sex, race, age, and other demographic factors. The population-based registries, the hospital-based registries include all the patients which are treated by a particular institution, where inpatient or outpatient. Registers should collect the uniform minimum set of data recommended in the WHO handbook for standardized cancer registers. If there is a long-term follow-up of a patient, hospital-based registries can be of a considerable value in the evaluation of the diagnostic and treatment programs. While there are certain special cancer registries which collect and maintain data on a particular type of cancer, these registries often provide informational opportunities for those who want to learn more about the specific type of cancers and support for those who may suffer from it. Coming to the most common type of cancers which are occurring in our part of the world, first of all, breast cancer. So female breast cancer is the most commonly diagnosed cancer that it constitutes about 11.5% of the total cases globally, according to the Globocane 2022, and it is the most second most common cause of death among cancers. So there are risk factor for breast cancer. There are certain non-modifiable risk factors which include female gender, age greater than 45 years of age, genetic changes, family history of cancers, personal history of breast cancer, race and ethnicity, dense breast tissue, certain benign cancer condition, lobular carcinoma in situ, menstrual periods, for example, early menarche and late menopause, previous chest radiation, and exposure to diethylstilbestrol. While the modifiable risk factors includes not having children, oral contraceptive use, Depo-Provera use, hormone therapy after menopause, breastfeeding, alcohol consumption, obesity, which increases the risk, and physical exercise, which causes risk reduction. So the sign and symptoms of breast cancer they are typically presents at the swelling or lump in the breast, swelling in the armpit, persistent breast tenderness or pain, or nipple changes or discharge. The diagnosis of breast cancer is usually done with the help of a triple test approach of diagnosis. First of all, there is clinical examination, and which includes history, and the physical examination, including the inspection and palpation of the lump. The second modality is the breast imaging, which includes mammography, breast and axillary ultrasound, and breast magnetic resonance imaging. And the third and the definite diagnosis is made by the core needle biopsies of suspicious lesions. The treatment of breast cancer again ranges from surgery, targeted therapy, radiation, chemotherapy, and hormonal therapy. The prevention of breast cancer, it is usually can be prevented with the help if you continue to breastfeed to your child. If you are a mother, don't smoke, limit the use of hormone medication, limit the exposure to pollution, limit the use of alcohol consumption. You should exercise regularly, keep your weight down, eat healthy food, watch any changes on your breast, and go for a mammogram. The screening criteria for breast cancer, American Cancer Society recommends that early detection of breast cancer can be done with the help of mammography. The usual guidelines are that women who are above the age of 40 to 44 years of age, they should have the option to start cancer screening with a mammogram every year, while women who are between the age of 45 to 54, they should get a mammogram every year, while women who are 55 and older, they can switch to a mammogram every other year, or they can choose to continue yearly mammograms. Screening should continue as long as the woman in a good health and is expected to live at least 10 years more. So, for high risk women, breast cancer screening can be started typically as early as at 30 years of age. So, October is usually known for the Breast Cancer Awareness Month. The next common cancer in female is the cervical cancer. So every year, around 5,008 women are diagnosed with the cervical cancer, and there are 3,197 die from the disease. Cervical cancer rank as the third most frequent cancer among women in Pakistan, and the second most frequent cancer among women between the age of 15 and 45 years of age. And about 0.5% of the women in the general population are estimated to harbor the cervical human papilloma 1618 virus infection at a given time, and 88.1% of the invasive cervical cancers are attributed to HPV's 16 or 18 strain. The common risk factor for the cervical cancer are the HPV infection, multiple sexual partners, early sexual activity, weakened immune system, smoking, long-term use of the birth control pill, a history of the sexually transmitted infection, family history of the cervical cancer, socioeconomic factors, and again the exposure to diethylstilbestrol. The sign and symptom of the cervical cancer range from the fatigue, unexplained weight loss, heavy vaginal bleeding, bleeding during sexual intercourse, blood tint vaginal discharge with a strong odor. Rarely there is a presence of vaginal mass. There is pain in pelvis, lack of appetite, pain in back and legs, and bleeding after pelvic examination. The diagnosis of the cervical cancer can be done with the help of the colposcopy, which is a magnifying device which is used to examine the cervix for abnormal cell. Then we have the options of biopsy and imaging testing, which includes CT scans or MRIs. The treatment of the cervical cancer includes the surgery, radiation, targeted therapy, immunotherapy, and chemotherapy. The prevention, how can we prevent cervical cancer? So we should get vaccinated against HPV, practice safe sex, undergo regular pap smears, quit smoking, maintain a healthy lifestyle, and stay informed and educated. Those the screening guidelines according to the American College of the Obstetric and Gynecology. If you are younger than 21, you don't need screening. If you are between the age of 21 to 29, you should have a pap smear done every 3 years. If you are between the 30 to 65 years of age, you can choose one of three option: having a pap test and HPV test co-testing, which is called basically as co-testing, done every 5 years. Have a pap test done alone every 3 years, and have a HPV test done alone after every 5 years. And if you are 65 or older, you do not need a screening. And you should remember that if you still need a screening, if you have been vaccinated against HPV, and you still need to have screening if you had hysterectomy and your cervix was not removed during that hysterectomy. Well Women Clinic. This is basically the initiative of the government of the Punjab, the primary and secondary healthcare departments of the government of the Punjab launched the Prevention and Control of the Non-Communicable Disease Program Punjab in 2016 to mobilize the provincial financial resources required for the implementation of the NCD's screening, awareness, and continuity of care intervention. In its fourth revision on 3rd September 2021, it was revised to include mental health component, type 1 diabetes, and diabetes in pregnancy, and screening of the complication which are associated with diabetes. 130 more service delivery points with the name of Well Women Clinics for the screening of the carcinoma of breast and cervical cancer screening. They are operating at the DHQ and THQ levels. So this diagram basically shows that even at the BHU level, you have the facility of the clinical breast examination done, and at the THQ and DHQ level, you can go for the visual inspection or via acetic acid for cervical cancer screening, and mammography at the level of DHQs, and you can also get your pap smear done at the DHQs. So the vaccination criteria for HPV vaccine to prevent the cervical cancer, it includes that if your child is between the age of 11 to 12 years, the first dose, it should be started between the 11 to 12 years, and it can be started as at early as 9 years of age, and the second dose is given at the interval of 6 to 12 months. If your children is between the 9 to 14 years of old, who have received 2 doses of HPV vaccine less than 5 months of apart, they will need a third dose. People who are between the 15 to 26 years old, and they want to get vaccinated, so they should start the series later. They need the 3 doses of HPV vaccine, and again these doses are given at the interval of 6 months of age. People who are 26 years older, they generally the vaccination is not recommended for them. But if you want to get vaccinated, adult age between 27 to 45 years of age, they can get the HPV vaccine after talking to their doctor about the risk of new HPV infection and the possible benefit of vaccination for them. So HPV vaccination in this age ranges provide less benefit because more people in this age, they have already been exposed to the human papilloma virus again, and the people with the weakened immune system or who are immunocompromised, they should get 3 doses if they are between the 96 to 9 to 26 years old. So cervical cancer awareness month, January is usually considered as the cervical cancer awareness month. Lung cancer, the most common type of cancers which occur in the male population in Pakistan is lung cancer. Lung cancer is the most common cancer with the incidence rate of about 12.4% worldwide. The most common cause of cancer death in 2022, accounting for about 1.80 million deaths. The risk factor for common lung cancer, the common risk factors for the lung cancers are occupational: minors who are exposed to heavy metals, smoking tobacco, secondhand smoking, a family history of the cancers, again dietary factors, radon gases, aging, other conditions such as COPDs and tuberculosis, pollution, and exposure to radiations. Sign and symptoms. The sign and symptom of lung cancer ranges from a persistent cough, repeat or frequent chest infection, tiredness, chest pain, clubbed fingers, shoulder pain, a lump in your neck, shortness of breath, coughing up blood, losing weight or loss of appetite, a cough that changes or gets worse, a hoarse voice or wheezing, back pain, and difficulty in swallowing. The diagnosis of lung carcinoma includes a variety of tests. Initial test includes the lung function test and bronchoscopy, followed by CT guided biopsy and CT scans, then MRI, and final diagnoses are made with the help of CT scan or PET CTs. Treatment, again, the treatment of lung cancer includes a variety of options starting from the surgery, chemotherapy, radiotherapy, immunotherapy, and targeted therapy. So, lung cancer, it can be easily prevented if you quit smoking, if you wear a mask to avoid air pollution, you exercise regularly, avoid secondhand smoking, avoid workplace carcinogen, and eat healthy. Screening, the lung cancer screening recommendations. The First of all, we need to calculate the pack year. So, with the help of pack year, we can know for how long the person is smoking. For people, the lung cancer screening is usually recommended at 50 to 80 years of age. A pack year is a smoking of an average of one pack of cigarette per day for 1 year. For example, if a person could have a 20 pack year history by smoking one pack a day for 20 years or two packs a day for 10 years. Lung Cancer Awareness Month. So, November, which is the ongoing month, is currently considered as a Lung Cancer Awareness Month. Recent update in cancers, current advances and the future prospect in cancer immunotherapeutics. This article was published in 2023 and this states that the recent immunotherapy, it has become a remarkable cancer treatment method with the development of CAR T cells and ICI, which are the immune checkpoint inhibitors and cancer vaccines. In preclinical studies, it has been determined that the combination therapy of CAR T cells and ICI is an effective on various malignancies and is even more effective than the treatment which is used alone. So CAR T cell, what is CAR cell T cell therapy? The CAR T cell therapy basically is a chimeric antigen receptor T cells which have become a new form of as a cell-based immunotherapy in which T cells from cancer patients are genetically modified and are used to target tumor. With the recent development in the genetic engineering, a chimeric receptor is expressed and cancer cell with the potent anti-tumor effects are targeted. CAR T cell therapy use patients autologous T cells to generate a tumor antigen specific CAR ex vivo and then infuse CAR T cell back into the patient. Because of the CD19 expression, blood cancers are the most amenable disease group to occur in the future of CAR cell T cell therapy. High level of tumor expression of the targeted antigen, the ease of assessing tumor cell via blood and lymphatics, and the tolerability of the non-tumor effects of B cell aplasia on the target make CD19 a good candidate for targeted therapy. So now we will go through the multiple choice question. The first question is in terms of the number of cancer related death worldwide, the most common cancer is colorectal, skin, lung, breast, liver.
Lung.
Yes, C is the right answer. Cancer screening is defined as the search for unrecognized malignancy by means of a rapidly applied test. For which of the following cancer screening is recommended only in the high risk group? A, breast and lung cancer, B, breast and cervical cancer, C, lung and liver cancer, D, cervical and lung cancer, D, liver, lung, and colorectal cancers.
E.
Yes, E is the right answer. A 45-year-old female having a strong history of the breast cancer and taking Depo-Provera injection IM for the last 5 years visits her family physician for routine medical checkup. Patient is considered to be at high risk for breast cancer. According to the new guidelines, at which age should she get her mammography done yearly? Option A 35, B 40, C 45, D 30, E 32.
A.
No, the right answer is D. For high risk groups, the yearly mammography can be started as early as at 30 years of age. Number 4, the cervical cancer is the fourth most common cancer in women worldwide. Which of the following is the recommended screening method for the cervical cancer in women aged 30 to 65 according to the most guidelines? A, pap smear every 3 years, HPV testing every 3 years, pap smear combined with the colposcopy every 5 years, pap smear combined with HPV testing every 5 years, pap smear combined with HPV testing and colposcopy every 5 years.
E.
The answer is D, pap smear combined with HPV testing every 5 years. A patient presented in pulmonology OPD with the complaints of blood stain, productive cough, shortness of breath, chest pain, and weight loss. Which of the following is not the criteria for the lung cancer screening? A. Age 50 to 80 years, passive or second-hand smoke for last 10 years, currently smoking, former smoker for 15 years, and 20-year pack history. The, the right answer is B. Passive or second-hand smoker for the last 10 years. Number six is female breast cancer is the most commonly diagnosed cancer that accounts for 11.7% of the cases globally, according to the Globocane 2022. Awareness campaign and on risk factor in screening of the high risk group should be encouraged. Which of the following is a non-modifiable risk factor for breast cancer? A. OCP's use. B. Depo-Provera. C. Breastfeeding. D. Obesity. E. Late menopause.
E.
Yes, E is the right answer. HPV vaccination is recommended for the women of the reproductive age. Which of the following is known benefit of the HPV vaccine in terms of the cervical cancer prevention? A. It is only effective in female who are already HPV positive. It provides lifetime immunity against all HPV strain. It prevents the development of HPV related cervical precancerous and cancerous lesion. It eliminates the need for regular pap smear. It prevents the recurrence of cervical cancer in women already diagnosed.
C.
Yes, C is the right answer. The eighth MCQ is vaccination against HPV can prevent from cervical cancer. What is the recommended number of doses for HPV vaccine in individual age 9 to 14 years? A 1 dose, B 2 dose, C 2 dose with a booster dose, D 3 doses, E 4 doses.
B.
Yes, B is the right answer. And the ninth MCQ is which of the following type of cancer registries is typically responsible for tracking cancer cases with a specific region or country? A. Population-based registries. B. Hospital-based registries. C. International cancer registries. D. Private cancer registries. E. Special cancer registries.
C.
The answer is A. Population-based cancer registries. 10. A 56-year-old female comes to OPD with the complaint of the right breast lump and nipple discharge. Patient is nulliparous and has a strong family history for breast cancer. Which of the following is the most sensitive and specific screening test to detect breast cancer? A. FNAC, which is fine needle aspiration cytology. B. Mammography. C. Breast self-examination. D. Breast and axillary and ultrasound. E. CT scan.
A.
The right answer is B, mammography. It is both specific and sensitive. This is the key to MCQs. This is our YouTube channel where this presentation will be uploaded. These are my references which are used in the presentation. And thank you.